Carpal tunnel syndrome, CTS, is a condition that affects the hand and wrist, causing pain, numbness, and weakness. It occurs when the median nerve, which runs from the forearm into the palm of the hand, becomes compressed at the wrist. The carpal tunnel is a narrow passageway in the wrist that is surrounded by bones and ligaments. The median nerve controls sensations to the palm side of the thumb, index finger, middle finger, and part of the ring finger, as well as controlling some small muscles at the base of the thumb that help with grip strength. Causes of carpal tunnel syndrome. Carpal tunnel syndrome is primarily caused by the compression of the median nerve as it passes through the carpal tunnel. This compression can be triggered by several factors. Repetitive hand movements, jobs or activities that involve repetitive hand movements, such as typing, using a mouse, assembly line work, or playing musical instruments, are known risk factors for CTS. Prolonged flexion or extension of the wrist can increase pressure on the median nerve. Injury or trauma, wrist fractures, dislocations, or any trauma that causes swelling or scarring around the carpal tunnel can lead to compression of the median nerve. Inflammation, conditions that cause inflammation, such as rheumatoid arthritis or diabetes, can lead to swelling in the wrist, which may compress the median nerve. Hormonal changes, women are more likely than men to develop CTS, especially during pregnancy, menopause, or other times when hormonal changes cause fluid retention and swelling. Anatomical factors, some people may have a naturally smaller carpal tunnel, which makes them more prone to developing CTS. Symptoms of carpal tunnel syndrome. The symptoms of carpal tunnel syndrome usually develop gradually and often begin as mild discomfort that worsens over time. Early signs include numbness and tingling. Individuals with CTS often experience numbness or a pins and needles sensation in the thumb, index finger, middle finger, and part of the ring finger. This sensation is often more pronounced at night or after activities that require repetitive hand use. Pain. Pain may occur in the wrist, palm, or forearm, and can radiate up the arm. It is common to feel pain at night, which can interfere with sleep. In some cases, the pain can become severe enough to affect daily tasks. Weakness. As the condition progresses, individuals may experience weakness in their hand, making it difficult to grip objects, such as a pen, phone, or a jar lid. Decreased sensation. Over time, the compression of the median nerve can lead to decreased sensation in the fingers and hand, which can impact fine motor skills, such as buttoning a shirt or typing. Diagnosis of carpal tunnel syndrome. The diagnosis of CTS begins with a medical history and a physical examination. A healthcare provider will often perform several tests to evaluate the nerve's function, including Tinel's sign. This test involves tapping on the wrist over the carpal tunnel to see if it causes tingling or discomfort in the fingers. Phelan's test. The patient is asked to hold their wrists in a flexed position for 60 seconds to see if it triggers symptoms of tingling or numbness. Electrodiagnostic tests. In some cases, nerve conduction studies or electromyography, EMG, may be performed to assess the electrical activity of the median nerve and confirm the diagnosis. Treatment of carpal tunnel syndrome. Treatment options for CTS vary depending on the severity of the condition. Early intervention can often prevent the need for surgery. Conservative treatments. Wrist splints. Wearing a wrist splint at night to keep the wrist in a neutral position can reduce pressure on the median nerve. Medications. Over-the-counter anti-inflammatory medications, such as ibuprofen, can help reduce inflammation and relieve pain. Physical therapy. Stretching exercises and strengthening exercises for the wrist can improve flexibility and reduce symptoms. Steroid injections. In some cases, corticosteroid injections may be used to reduce inflammation around the median nerve, providing temporary relief. Surgery. If conservative treatments do not alleviate symptoms, surgery may be required. The most common surgical procedure is carpal tunnel release, where the ligament pressing on the median nerve is cut to relieve pressure. Prevention of carpal tunnel syndrome. To prevent CTS, individuals can take steps to reduce strain on the wrists, such as ergonomic adjustments, adjusting workstation setups, including using an ergonomic keyboard or mouse, can reduce the risk of developing CTS. Breaks and stretching, regular breaks from repetitive activities and stretching exercises can help reduce the risk of strain. Proper wrist positioning, keeping wrists in a neutral position during tasks can prevent excessive flexion or extension. Carpal tunnel syndrome is a common and treatable condition. Early diagnosis and appropriate interventions can help manage symptoms and improve quality of life for those affected by it.